So, this is Germany calling Sweden. Can you hear me, Dr. Rushworth?
Yes, I hear you loud and clear.
Welcome to hashtag Alles auf den Tisch, which stands for all facts on the table. It's my great pleasure to have you in this conversation. Let me introduce you to our listeners very quickly. You are a doctor working in Stockholm, Sweden. You are the author of your own blog, which is about health and science, not only about the subject we're going to talk about today, COVID-19, but also about other health issues. I have been following it for several months now. I must say it's quite enlightening what you clear up and what you discover, always based on the naked numbers and facts. You have also written a book called COVID, Why Most of What You Know is Wrong. So actually this somehow implies already in the title that many of us seem to be, or you think are, badly or even misinformed. Is that correct?
Yeah, I think most people are very badly misinformed about the situation with COVID. Definitely.
Okay. Well, you are in Sweden working as a doctor. Now, we all know Sweden went another way in dealing with this pandemic. You never went into lockdown. You kept all restaurants, gyms, and especially schools open, and wearing masks was even not mandatory. I thought this is actually the normal way of dealing with such a situation, but it was seen as a huge experiment by the rest of the world who went into lockdown. But let's maybe start with the basic thing. How deadly is COVID-19? How dangerous is it really?
Well, there have been studies that have tried to estimate this, and the best way to estimate is by looking at, well, you can't do this anymore now that people have been vaccinated, but before everyone started being vaccinated, you could look at how many people have antibodies, and then you could compare that with how many COVID deaths do we have, and that can give you kind of a picture, because a lot of people who have COVID have very mild symptoms. A lot of people have no symptoms, and so just looking at cases will give the impression that the disease is much deadlier than it actually is. So if you want to get a proper idea, you have to look at just take a random sample of the population and measure antibodies instead, because then you'll pick up all of these asymptomatic or only very lightly symptomatic people that haven't bothered to get a PCR test. And when we do that, the general consensus now is that somewhere between 99.7 and 99.8% of people who get COVID survive it. So I mean, it's not a very deadly disease from that perspective. That does kind of miss the point a bit, because there is a lot of variation in terms of your risk depending on how old you are and what underlying conditions you have. If you're a completely healthy 30-year-old, the risk is infinitesimally small. You're more likely to die in a traffic accident than you are to die of COVID. While if you're 80 years old and have some underlying health issues, the risk can be big. It can be upwards of maybe 10%. So there's this huge difference between healthy young people, where the risk is 1 in 10 or 1 in 20, 1 in 30,000. And the elderly, where the risk might be up 1 in 10.
Okay. What about the so-called long COVID? I mean, many people know that they will survive if they get it because they're healthy, but still they're very much afraid of, this called so long COVID. What's the matter with that?
So I think this is something that's really been built up by the media and made into something much bigger than it really is. I mean, we know if you get really sick with COVID, if you end up in the hospital, especially if you end up in the ICU, there is a significant risk that you're going to have long-term complications, just as if you become sick for any other reason. if you have a stroke, if you have a heart attack, if you're that so sick that you need to spend time in an ICU for regardless of the reason, there is a significant probability that you're going to have long-term symptoms. But I guess the thing that makes people afraid of long COVID is that even people who have very mild symptoms are then supposedly continue to in various ways feel sick for a long time afterwards, and some even think this is like a lifelong condition, which is funny for a disease that's only existed for a year and a half. How can you know this is going to be a lifelong condition? But there have been studies that have followed people with symptomatic COVID for months afterwards to see how long does it take them to recover, and they've found that after 3 months, 98% are fully recovered. So only 2% still have any remaining symptoms after 3 months. Okay. The vast majority of people are fully recovered within a few weeks. And if you look at the curve, it's like this. So after 1 month, there's still a couple of percent, and then after 2 months, it's lower. After 3 months, it's even lower. These studies have only gone out to 3 months, so we don't know where the number is at the 6 month point, but it's reasonable to assume that the curve continues downwards, and that, I mean, the number of people who still have symptoms beyond 6 months is tiny, is a fraction of a percent. So I think
long COVID is kind of really pushed by the media, you would say.
Yeah, so I mean, maybe it is a real thing, but I mean, we have these conditions like chronic fatigue syndrome, ME, that people don't really know what it is, but sometimes after viral infections, people continue to have symptoms for a long time afterwards, but it's extremely rare. It's a small proportion that have this, and the media have blown it up to seem like this is something that like 20 or 30% suffer from, but actually it's very rare, and it's not something that people really need to be overly worried about. There are many other risks they face on a daily basis that are much bigger.
Okay. Next question. Sweden, especially in German media, I don't know about other countries, but I think it's more or less the same in the mainstream media, is now still seen or described as a failure because more people died per 100,000 than in other Nordic countries. I mean, you always have these comparisons between Sweden and Norway, Finland, Denmark, its neighbors. Is it like that? Did more people die in Sweden? And is there a reason for it? Or is the reason actually that you didn't go into lockdown?
Yes, more people have died in Sweden as a proportion of the population than in Norway, Denmark, and Finland. And there are many different reasons for that. But I think the main thing is, well, if you look back at historic pandemics, what is the pattern? And if you look at every previous pandemic in the 20th century, Sweden had a much higher death rate than Norway, Finland, and Denmark. So clearly there is some underlying difference between Sweden and its neighbors that causes it to, in pandemics, have a higher death rate. It clearly has nothing to do with lockdowns. There have been studies that have attempted to correlate the severity of lockdowns with the number of people dying, and they haven't been able to find any pattern. Some of the countries with the harshest lockdown measures also have the highest COVID fatality rates, and other countries that have taken a very mild approach can have very low fatality rates. And I mean, it's become pretty clear that lockdowns are ineffective, so they can't explain the difference. There are other things that can explain the difference. Sweden it has a more urbanized population than its Nordic neighbors. The Nordic country that has the second highest death rate is Denmark, which also has the second most urbanized population. So people are living more tightly together. Sweden has more international travel, so we got a lot more COVID into the country early in the pandemic when the treatments were still being figured out, and when people were more likely to be harmed by the healthcare system than they are now, because they were getting a worse treatment. I mean, we were intubating people pretty much the moment they came in through the hospital, and after a while we realized that that was actually probably killing people, and so I mean, Sweden got hit hard in the early part of the pandemic, and Denmark, Finland, and Norway, they completely avoided the first wave just because there's less international travel. They didn't get the virus into the country until the autumn of 2020, right. And by that time we'd kind of figured out better how to deal with COVID, how to treat these patients. Yeah.
Wouldn't it make anyways more sense to compare Sweden with Sweden from the past years? And that would lead to my next question. I mean, what is actually the so-called excess mortality in Sweden? Mm-hmm. Because we were told all over the world, going into lockdown is without an alternative. If we don't do it, hundreds of thousands of people will die. And so, I mean, you must have a terrible excess mortality, as you didn't go into lockdown.
Well, and that actually brings up another big explanation for the difference between Sweden and its Nordic neighbors. Sweden had an unusually low mortality rate in 2019, while its neighbors had a normal or even high mortality rate. And I mean, just because of the fact that people aren't immortal, I mean, if fewer people die in 1 year, more people are going to die in the next year. It's kind of like just a general statistical rule. So going into the pandemic, Sweden had an unusually large number of very frail elderly people who would normally have died the year before, but who didn't. And our neighbors didn't have that. Okay. Which is also one part of the explanation. But so you asked about the excess mortality, and yes. And well, in a normal average year, about 0.9% of Sweden's population dies. Mm-hmm. And in 2020, that number was 0.95. So the mortality rate increased, but I mean, in absolute terms, by 0.05%. Mm-hmm. And if you want to take that in relative terms, that's like 5% more than would have been expected. And to me, that in itself says something about how deadly this pandemic is, because a deadly pandemic that only increases mortality by 5% in relative terms is not a very deadly pandemic. I mean, if you look back at the Spanish flu, yeah, in 1917, the death rate shot up enormously. If you look at the graph of the death rates in different years, you will see a huge spike in 1917, 1918, 1919. If you look at 2020, there's no spike there. There's barely a blip in terms of how much more the number of people died than what you would normally have expected.
So that makes actually lockdowns not look that helpful. I mean, there should be a huge spike in Sweden, but there isn't, because you didn't go into lockdown, so you didn't even wear masks. I mean, I was there. I wrote you earlier on last New Year's Eve, because we were all locked down. So I took a flight to Stockholm, and I couldn't believe my eyes to go into restaurants, and people were just behaving normal. I mean, like before. What is the situation today in Stockholm, in Sweden? I mean, is it over? Is it still continuing? What's going on?
Well, the virus is continuing to spread at a low level, which, I mean, once a virus becomes a part of appears on the planet, it doesn't disappear. I mean, COVID's here to stay, and so there is some continuing spread at a low level, and I would expect there's going to be a little bit more in the autumn and winter, just because of pure seasonality. These types of viruses, they spread more in winter and less in summer, and so that's what I'm kind of expecting at the moment. Sweden is life in Sweden is kind of like it was before the pandemic started. There are no special measures in place anymore, really, and to me, life feels like it did before the pandemic.
And your hospitals are not overrun by?
In all of Sweden at the moment, there are roughly 200 people being treated in hospitals for COVID. I mean, and this in a country with 10 million people. It's personally, I haven't seen a COVID patient in at least 5 or 6 weeks. I mean, I've seen more people who have been harmed by the vaccines in the hospital than who have been harmed by the virus in the last couple of weeks.
Well, the vaccines are a different story. We wanted to concentrate now into, what's the difference between going into lockdown and not? What would you tell any politician who's, I mean, here in Germany, we are hearing things that people are thinking about. It could be another lockdown, maybe only for those who are unvaccinated. We don't know yet, but it's kind of this, the Damocles sword hanging above our heads. So what would you tell people, or people who are still actually in favor? I mean, I know many people who were so happy about the lockdown and that we got saved, but it's clear that lockdowns, they cause so much damage. I mean, to the children and students, and I mean, to social life, to actually everything. So what would you tell people?
Well, I think the measures taken need to be proportionate to the severity of the disease. And I mean, well, it's one thing that the measures taken need to be effective, and there's no evidence that lockdowns are even slightly effective. But I mean, if we assume that they were effective, they are so harmful on so many levels to society. I mean, obviously, taking children out of school is harmful to them. Shutting down businesses, making people unemployed is harmful to people in many different ways. Shutting down a society has so many different harms, and so even if the measure is effective, it's such a severe measure that it needs to be weighed against the potential benefit and against the seriousness of the disease. And I mean, if this was the Spanish flu, maybe lockdowns would be appropriate if they worked, but it isn't. It's a disease that's dangerous to the old and the frail, but for young, healthy people, it doesn't present a threat at all. And then the question is it reasonable to shut down a complete society for this virus that on the whole, to the vast majority of people, does not actually present a threat?
Yeah, well, I this is what I was missing everywhere where lockdowns were done. There was never actually this weighing. Okay, what does COVID-19 do, and what does a lockdown do? I mean, you have to make a risk balance somehow, and we only got this in the media and from politicians that if you don't do the lockdown, hundreds of thousands will die, and obviously it doesn't seem to be true at all. I can only thank you for your time and for being so reasonable and making things clear, because still I believe many people are so afraid of the virus that they would prefer to go into the harmful lockdown again. Yeah, but maybe it's not wanting to play it down. I mean, it's a serious sickness, it's no doubt, but for most of us not, and maybe we should try to live our life again. Yeah.
I think that would be sensible.
Okay. Thank you so much, Dr. Rushworth. I would like to recommend once again, sebastianrushworth.com is your homepage where you're writing your blog. It's most interesting stuff, not only about Corona. And well, thank you so much.
Thank you very much.
Okay, thank you.